Hello everyone, myself Preeti Sharma, Assistant Professor in RKGIT Ghaziabad. So, in the today's session, I will discuss about the general principle of prevention and the control of hypertension. So, as all knows what is hypertension. Usually we define hypertension as the systolic blood pressure which is greater than 140 mg and a diastolic pressure that is greater than 19 mmHg based on the average of 2 or more. Accurately we are measuring blood pressure, as all knows that blood pressure, it is the amount of force that is applied on the walls of the arteries as the blood circulates around the body. And hypertension is a global health challenges, and it is prevalence is increasing rapidly amongst adults in many African countries. Hypertension and other non-communicable disease are currently responsible for at least 20% of all the death in Nigeria, and although it is rarely cause symptoms on its own, its complications can lead to suffering, avoidable death and financial burdens. So, BP. So, hope all understood what is hypertension. Again I am repeating, it defined as the systolic blood pressure which is greater than 140 mmHg and diastolic pressure is greater than 19 mmHg. And blood pressures means the amount of force which is exerting on the walls of the arteries as the blood circulate in the body. Now, here in this presentation I will discuss about the global trends. What are the global trends of hypertension? It is a silent invisible killer that rarely causes the symptoms. It increasing the public awareness. Suppose in the prevention and the control, I will discuss here the early detections. There is two methods, primary and secondary. So, raised blood pressure is seriously warning signs that significantly lifestyle changes are urgently needed, and people need to know why raised blood pressure is dangerous and how it takes step to control it. Globally 1 billion people graphically with the conditions. Now, this is a table of blood pressure. So, you can see here the normal range of systolic and diastolic blood pressures. Normal range is 119 or lower, and in the diastolic you can see here the 79 or lower, and in the pre-hypertension you can see here this 120 to 139 the range of systolic blood pressure, and in same here with the diastolic blood pressure 80 to 89, and in the stage 1, when the stage 1 hypertension and stage 2 hypertension is achieved, then there will be a, in the stage 1 we will see here the 140 to 159 mmHg is the blood pressure range, and in the diastolic 90 to 99 mmHg. Similar we can go to the stage 2nd hypertension 160 or higher, and in the diastolic you can see here the 100 or higher. Now, pre-hypertension. Pre-hypertension is not a disease, it categorized rather than a designations for individual at high risk of developing hypertension, and it should be firmly advised to practice the lifestyle modification. Pre-hypertensive clients are not candidate for drug therapy if comorbidity test is exist, and then drug therapy is indicated if the trial of lifestyle modification fails or it may reduce to the 130 to 18 mmHg or less than that. It means how we can hypertension is basically classified into two types, primary and secondary. Primary hypertensions basically is due to the when the person will take a or the larger quantity of the sodium, intake of sodium is increased in that case, or if the intake of alcohol is increased, in that case the person will suffer from the primary hypertension. In the secondary hypertension, whether the person have a renal disease or have some other neurological disorder, and we can do the laboratory test to examine this hypertension. First one is urine lysis, and second is blood glucose, third is electrocardiogram, and lipid profile, and serum potassium creatinine. This I told you that it is primary hypertensions and the secondary hypertensions. You can see here the secondary hypertension and primary hypertensions, and it is also known as the essential hypertension. Account 95% cases of hypertension gradually in onset, and there is a strong family history, or it is due to the increased when the person will take a increased amount of sodium, or intake of sodium is increased, or we can say the alcohol intake is increased by the person, then there will then it comes under the primary hypertension. Or the person have some disorders like neurological disorder or the renal failure, due to that the person is having a hypertension, it comes under the secondary hypertension. It less common cause of hypertension, 5% dramatic in onset. Now, these are the risk factor for primary hypertension: alcohol, cigarette smoking, diabetic mellitus, elevated serum lipid, excess dietary sodium, obesity, and the stress. Due to this non modifiable risk, due to this factors or some parameters, there will be a risk factor for the primary hypertensions. Now, investigation. We can investigate the hypertension with the help of urine for protein, glucose, and blood, and FBC and FBS. FBC means full blood count, and the FBS means fast blood sugar, and ECG, electrocardiogram, through the electrocardiogram or by X-ray, chest X-ray, we can by taking the serum total cholesterol, HDL and LDL, or by examining the lipid profile with the help of this HDL and LDL, and the serum potassium and the creatinine. With this we can investigate the initial stage of the hypertension. These are the additional investigation. First is BP recording, renal ultrasonography, renal angiography, 24-hour urine assay for creatinine, metamorphins and catecholamines or plasma catecholamines if have a suspected pheochromocytoma, and the plasma renin activity and aldosterone. Now, this is the initiation of therapy. These are some laboratory tests which I told you, and we can now we have to come to the point that how we prevent and control this hypertensions. There is a population strategy, and the how we can control the hypertension in a population by giving a proper nutrition to each and every person, by appropriative calorie, by giving appropriative calorie, moderate fats and no alcohol. If the person is do not use the alcohol, and low salt intake, adequate fibers. These are some population strategy we have to focus on some of the points by taking proper nutritions, moderate fat. By we can reduce our weight reduction can be done by using a proper nutrition and exercising daily, and regular physical exercise is required to reduce the weight, and behavior change, no smoking, reduction of stress, and yoga by doing yoga and exercise daily, health education and self care. Now, the lifestyle modifications for the prevention and management of the hypertension. First is lose the overweight, limit the alcohol intake. Second is increase the aerobic physical activity, reduce the sodium intake, maintain a adequate intake of potassium, maintain the adequate intake of the calcium and the magnesium, and stop smoking. These are some of the points that we can prevent and control the hypertensions. So, there are some features of integrated primary care program. Integrated program must be established at the primary care level for control of hypertension. In most of the countries, this is the weakest level of the health system. Treatment should be targeted particularly at people with the medium or the high risk of developing heart attack, stroke or the kidney damage. Now, this is the cost of implementing the primary care program. The cumulative cost of implementing an integrated primary care program to prevent the heart attack, stroke and kidney failure using the blood pressure as the entry point that address cardiovascular disease and cervical cancer in all the low and middle income countries. So, we can prevent this hypertension with the three of the reason. I discussed the three main important points: by physical exercising, and by taking a appropriate nutrition, and with the help of using the drugs, antihypertensive drug. We can use the antihypertensive drug, AC inhibitors, angiotensin second receptor blocker, and by using the calcium antagonist. And fourth is diuretics, means with the help of these antihypertensive drugs we can treat the hypertensions. AC inhibitors like, for example, captopril, enalapril, and angiotensin second receptor blockers, losartan, irbesartan and azilsartan. These are some drugs. You can note down the here. You can write the name of the this AC inhibitors. We can use AC inhibitors. AC inhibitors. Another one, you can go for the calcium channel antagonist. Calcium channel antagonist. AC inhibitors means captopril. The drugs comes under the AC inhibitor is captopril, and the next is calcium channel antagonist. You can go for the verapamil, and for the diuretics you can go to the thiazides, and the direct vasodilators also used for the to control the hypertension. Now, there are some primary prevention. There is an high risk strategy, means by subject have to, means patient. Here subject I am focusing on the patients. If patient with any of the risk factors, tracking of BP in a subject with very suggestive hypertension, then there will be some points you have to remember for that type of patients. Means dietary approach is an important step to control the hypertension and reduce the dietary saturated fat and the cholesterol. and high, we can say the diet should contain the fruits and the vegetable, and low fat dairy products will leads to the lower BP, means blood pressure. So, the important is the dietary approach is required to control the hypertension, and there is the nutrition is one of the most important approach, that moderate fat is given to the patients. Regular physical exercise is also required. Behavior change like no smoking, reduction of stress, daily exercise, and there will be a meditation is one of the important things to control the hypertension. So, the secondary preventions, we can come to the secondary prevention, means early diagnosis and case detections. If we earlier detect that hypertensions, then we can control the hypertension. If we detect the hypertension symptoms earlier, before the severity, if we detect the diagnosis, or we detect with the help of test, laboratory test, or by recording BP daily, then we can give a prevention and control to the people earlier. Now, we can come to the means complications and the consequence. Here you can see the WHO costing tool to estimate the cost of establishing the program in any country, availability of basic technology to manage people with hypertension, and the here you can see the availability and appropriate use of essential medicines to prevent complications in people with moderate to high cardiovascular risk. So, screening of population in the absence of symptoms, example, every individual should go for at least once a year for BP checkup, and like every Europeans go for once in a 2 years, means mass screening is also required, and fruitfulness. Screening of the population in the absence of symptom is also required. Every individual have to go for at least once in a year for BP checkup, and in Europe once have to go in 2 years. So, the link between different level of the, as I told you, primary and secondary level of preventions. In the primary level means what type of treatment we are giving to the initial treatment we are giving to the patients, that comes under the primary prevention, and the secondary preventions means early diagnosis of a symptoms of a hypertensions before the severity, means it go to the level of the severity. Before that we are detecting the symptoms of the hypertension, and we are giving the treatment to the patients. The treatment which I told you, first is physical activity, means exercise, daily exercise is required, nutritious food, all must have to take the nutritious food, and antihypertensive drug is also necessary to control the this we can say in the severity. We are taking the antihypertensive drugs like AC inhibitors. I told you in the previous slides, like AC inhibitor, angiotensin second receptor blockers, and the calcium channel antagonist, and another one is direct vasodilators you can take. And screen out the the populations in the absence of symptom is also very important. Once in a year go for the BP checkup. So, the link between different level of the health system, so that people can be managed approximately based on their level of risk, and the cost of implementing such a program is very low, and the reduction of risk factor in the population. Most cardiovascular disease in a population occur in people with the average risk level because they constitute the largest proportion of the populations. So, mass screening, as I told you that mass screening is also required for the hypertensions, for the prevention of hypertensions. Assess lifestyle and other cardiovascular risk factor that affect the prognosis and the treatment. Next is assess the presence or the absence of target organ damage, means assessing is required, screening and assessing is the fruitfulness to control and prevent the hypertension. WHO, here you can see workplace wellness program and high blood pressure control. WHO considered workplace healthy programs to be one of the most cost effective, and workplace wellness program should focus on promoting worker health through the reduction of individual risk related behavior. As I told you in the previous slides, what are the complications that can cause the, or what are the consequences for the untreated hypertensions, that is congestive heart failure, stroke, heart attack and the kidney disease. Tobacco use, unhealthy diet, harmful use of alcohol, physical inactivity and other related risk behavior. Due to these reasons, if the person is taking alcohol intake and physical activities, is not doing physical activity, then there will be a consequence, or we can say there will be a risk that the patient will suffer from this high BP. So, we need to control it with the help of the lifestyle modifications with or we can say by using the antihypertensive drug, and lose the overweight by taking appropriate nutritions or the proper diet, means dietary is should be high in the fruits and vegetable. So, each and every person have to use the proper diet to control and prevent the hypertension. Calcium and magnesium also should be maintained, adequate level should be maintained in the body, and especially the maintain the various minerals level should be maintained in the calcium, magnesium and potassium. This all should be maintained in the adequate amount in the body, and increase the aerobic physical activity, stop the smoking, reduce the dietary saturated fat and the cholesterol. So, by changing in the lifestyle modification, we can, one of the important and one of the best things how we can control it, students, we can control it with the help of lifestyle modifications and with the help of antihypertensive drug. We can control the hypertension, and by screening out earlier, if we screen out or we can detect our risk factor or the symptoms of this hypertension, then it is one of the most important things how we can control it and prevent it earlier. Now, the next one is monitoring the effect of action to tackle the hypertension. National Survey Health Information System must be strengthened to monitor the impact of action to prevent and control the hypertension and other risk factor for non-communicable disease. Monitoring the system must collect reliable information on risk factors and other determinants, non-communicable disease, mortality and illness. This data is critical for policy and program development. However, some countries still lacking the survey data for the hypertension and other risk factors. These are the health promotion for the general populations and disease prevention for the high risk group. Now we can come to the conclusion here. We stand at a critical crossroad in history when our action or inaction can shape the future of life on earth as we know it. This is a global challenge when requiring global cooperations among all sectors of the society. In the coming year, my hope is that government working with the business community and the various organization, foundation, academics and faith based group will continue to work with the United Nations to help and to forward the more sustainable pathway to the future. Working together we can bring an opportunity to all, and we can save the future with the help of controlling and preventing. We have to give the awareness to the people how we can prevent and control these hypertensions. So, what are the parameters? And the first important parameter I told you about the lifestyle modifications. So, we can control it with the help of these points, and these are some references. Thank you for your patience.